Question 1. A 2-year-old child presents with a sudden onset of barking cough and stridor after playing outside. The child has no fever. This presentation is most consistent with A. Croup, B. Epiglottitis, C. Bronchiolitis, D. Asthma exacerbation. Answer: A. Croup. This question assesses your ability to differentiate common pediatric respiratory conditions. The combination of a 2-year-old child, sudden onset, barking cough, stridor, and no fever points strongly to croup, laryngotracheobronchitis. Croup is a viral infection that causes swelling around the vocal cords, trachea, and bronchi, leading to the characteristic barking cough and inspiratory stridor. Epiglottitis typically presents with high fever and drooling, while bronchiolitis usually affects infants with wheezing. Recognizing the classic signs helps guide your initial assessment and care. Question 2. Which of the following best describes the purpose of a primary assessment in a medical patient? A. To gather a complete medical history. B. To identify and treat immediate life threats. C. To perform a head-to-toe examination. D. To determine the patient's chief complaint. Answer: B. To identify and treat immediate life threats. This question focuses on the fundamental goal of the primary assessment in EMS. The primary assessment is a rapid, systematic approach to identify and manage any conditions that are immediately threatening to the patient's life, often following the sequence of circulation, airway, and breathing, CAB, for unresponsive patients, or airway, breathing, circulation, ABC, for responsive ones. While a chief complaint is gathered and a history may be started, the core purpose is to quickly find and fix critical problems like a blocked airway or uncontrolled bleeding. For example, if a patient is unresponsive and not breathing, establishing an airway and ventilation is an immediate life threat that must be addressed first. Always remember that the primary assessment is about finding and fixing what will kill the patient now. Question 3. During your secondary assessment of a 7-year-old patient who was struck by a car, you note a rapid, thready pulse, cool, clammy skin, and delayed capillary refill. These signs are most indicative of A. Compensated shock, B. Decompensated shock, C. Neurogenic shock, D. Anaphylactic shock. Answer: A. Compensated shock. This question tests your ability to recognize early signs of shock, particularly in a pediatric patient. The keywords rapid, thready pulse, cool, clammy skin, and delayed capillary refill are classic indicators that the body is attempting to compensate for inadequate perfusion by constricting blood vessels and increasing heart rate. In compensated shock, the body's mechanisms are still able to maintain a relatively normal blood pressure, but if not treated, it will progress to decompensated shock. Pediatric patients are especially good at compensating until they suddenly crash. Always recognize these subtle signs of early shock in children and intervene before blood pressure drops. Question 4. A 60-year-old female is experiencing chest pain. She has a history of angina and takes nitroglycerin. She has taken 1 dose of her prescribed nitroglycerin 5 minutes ago without relief. Her blood pressure is 100/60 mmHg. What is your next consideration regarding nitroglycerin administration? A. Administer a second dose immediately. B. Administer a second dose only if her blood pressure increases. C. Do not administer another dose due to her current blood pressure. D. Increase the oxygen flow rate instead of administering more medication. Answer: C. Do not administer another dose due to her current blood pressure. This question evaluates your understanding of contraindications for nitroglycerin administration. While nitroglycerin is effective for chest pain, it is a potent vasodilator and can significantly lower blood pressure. A blood pressure of 100/60 mmHg is a critical finding because administering more nitroglycerin could cause a dangerous drop in blood pressure, leading to shock. Most protocols have a minimum systolic blood pressure, often 100 millimeters of mercury or 120 millimeters of mercury, below which nitroglycerin is contraindicated. Always check the patient's blood pressure before and after each nitroglycerin dose to ensure it is within safe parameters. Question 5. You arrive on scene to a single vehicle collision where a car has struck a tree. The driver is unresponsive with obvious severe facial trauma and snoring respirations. After ensuring scene safety, what is your immediate priority regarding airway management? A. Insert an oropharyngeal airway, OPA. B. Perform a head tilt, chin lift maneuver. C. Perform a jaw thrust maneuver. D. Insert a nasopharyngeal airway, NPA. Answer, C. Perform a jaw thrust maneuver. This question evaluates your knowledge of appropriate airway management techniques in trauma patients. The keywords single vehicle collision, unresponsive, severe facial trauma, and snoring respirations are critical clues. Snoring respirations suggest an airway obstruction, often the tongue, and severe facial trauma makes a head tilt, chin lift maneuver contraindicated due to potential cervical spine injury. The jaw thrust maneuver is the preferred method for opening the airway in trauma patients because it minimizes neck movement, helping to protect the spinal cord. Always prioritize spinal precautions in trauma patients, using the jaw thrust maneuver to open the airway unless it is ineffective. Question 6. What is the most important reason for an EMT to complete thorough and accurate patient care reports, PCRs? A. To satisfy administrative requirements for billing. B. To document time of arrival and departure. C. To ensure continuity of care and legal protection. D. To record personal reflections on the call. Answer, C. To ensure continuity of care and legal protection. This question highlights the paramount importance of documentation in EMS. A thorough and accurate patient care report, PCR, serves multiple critical functions beyond mere administrative tasks. It provides a detailed record of the patient's condition, assessment findings, and all interventions performed, ensuring that the hospital staff receives all necessary information for seamless continuity of care. Additionally, the PCR is a vital legal document that protects the EMT and the agency in case of legal challenges or questions about patient care. Good documentation is paramount for patient well-being and professional accountability. Question 7. A 68-year-old male is complaining of sudden onset shortness of breath and is anxious. He has a history of congestive heart failure. His skin is pale, cool, and clammy. Lung sounds reveal crackles, rowels, bilaterally. What is the most appropriate initial oxygen therapy for this patient? A. Nasal cannula at 2 to 4 lpm. B. Non-rebreather mask at 10 to 15 lpm. C. Simple face mask at 6 to 10 lpm. D. Bag valve mask ventilations. Answer, B. Non-rebreather mask at 10 to 15 lpm. This question tests your understanding of oxygen delivery for patients in significant respiratory distress, especially those with suspected acute pulmonary edema due to congestive heart failure. The keywords sudden onset shortness of breath, anxious, pale, cool, clammy, and crackles, rowels, indicate severe respiratory compromise. A non-rebreather mask at a high flow rate provides the highest concentration of oxygen to patients who are breathing spontaneously but inadequately, which is crucial for maximizing oxygenation in this critical situation. For example, a patient struggling to breathe needs a robust oxygen supply, not just a small supplement. Always provide high-flow oxygen with a non-rebreather to spontaneously breathing patients experiencing severe hypoxia or respiratory distress. Question 8. Which legal term describes the unauthorized touching of a patient? A. Negligence. B. Battery. C. Assault. D. Abandonment. Answer: B. Battery. This question tests your knowledge of legal terms relevant to EMS practice. Battery refers to the unlawful physical contact with another person without their consent. Even if you intend to help, touching a patient without obtaining consent can be legally considered battery. Assault refers to creating apprehension of harmful or offensive contact, while negligence is failure to meet the standard of care, and abandonment is leaving a patient after care has begun without proper transfer. Always obtain expressed or implied consent before any physical contact or medical intervention to avoid legal issues. Question 9. You are assessing an unresponsive patient found lying face down. After ensuring scene safety and checking for responsiveness, what is the most appropriate next step? A. Check for a carotid pulse. B. Turn the patient supine. C. Open the airway with a head tilt, chin lift. D. Begin chest compressions. Answer: B. Turn the patient supine. This question addresses the initial steps of assessing an unresponsive patient. When you find an unresponsive patient in a prone, face down, position, your immediate next step, after confirming unresponsiveness and calling for help, is to carefully roll them onto their back, supine position. This allows for a proper assessment of their airway, breathing, and circulation, ABC/CAB, and the ability to perform CPR if needed. You cannot effectively assess or manage an airway or perform compressions on a prone patient. Always ensure the patient is in a supine position to facilitate a full primary assessment and any necessary interventions. Question 10. What information is best obtained using the OPQRST mnemonic? A. Past medical history, allergies, medications, last oral intake, events leading to injury/illness. B. Onset, provocation, quality, radiation, severity, time. C. Signs and symptoms. D. Level of consciousness, responsiveness, chief complaint. Answer: B. Onset, provocation, quality, radiation, severity, time. This question tests your familiarity with common assessment mnemonics used to gather patient history. The OPQRST mnemonic is specifically designed to help EMTs systematically gather information about a patient's chief complaint, particularly pain or discomfort. Each letter represents a specific aspect of the complaint: onset, when did it start; provocation, what makes it better/worse; quality, how does it feel; radiation, does it move; severity, on a scale of 1 to 10, and time, how long has it been happening. This structured approach ensures a comprehensive history regarding the patient's symptoms. Question 11. A 24-year-old male is conscious and alert but experiencing a severe allergic reaction after being stung by a bee. He states he has a prescribed epinephrine auto-injector. His skin is red and hives are present, he complains of difficulty breathing, and his blood pressure is 88/50 mmHg. What is the most appropriate next step? A. Administer diphenhydramine, Benadryl, orally. B. Administer the patient's prescribed epinephrine auto-injector. C. Apply a non-rebreather mask at 15 lpm. D. Transport immediately without interventions. Answer: B. Administer the patient's prescribed epinephrine auto-injector. This question tests your ability to recognize and manage anaphylaxis, a life-threatening allergic reaction. Key indicators like severe allergic reaction, difficulty breathing, hives, and especially blood pressure is 88/50 mm of mercury, hypotension, signify anaphylactic shock. Epinephrine is the primary and most critical medication for anaphylaxis because it constricts blood vessels, relaxes airway muscles, and improves blood pressure. While oxygen is important, and antihistamines might be given later. Administering epinephrine quickly is life-saving for a patient in anaphylactic shock. Always prioritize administering epinephrine in cases of severe anaphylaxis, as it directly counteracts the life-threatening physiological responses. Question 12. A 30-year-old male is bleeding profusely from a deep laceration on his forearm after falling through a glass window. Direct pressure and elevation are not controlling the bleeding. What is the most appropriate next step? A. Apply a splint to the forearm. B. Apply a tourniquet proximal to the wound. C. Apply a pressure dressing and transport immediately. D. Pack the wound with sterile gauze. Answer: B. Apply a tourniquet proximal to the wound. This question assesses your understanding of advanced bleeding control techniques. The keywords bleeding profusely, deep laceration, and direct pressure and elevation are not controlling the bleeding indicate life-threatening hemorrhage that requires more aggressive intervention. When direct pressure fails to control severe extremity bleeding, a tourniquet is the next most effective and often life-saving intervention. It should be applied high and tight, proximal, on the injured limb, above the wound, to completely occlude blood flow. Knowing when and how to apply a tourniquet can prevent exsanguination. Question 13. A 72-year-old female complains of sudden onset of severe, crushing chest pain that radiates to her left arm. She states she feels nauseous and short of breath. Her blood pressure is 140/90 mmHg, pulse 98 bpm, respirations 20 bpm. She has a history of hypertension and takes nitroglycerin. Assuming local protocols allow, what medication should you consider assisting her with first, after administering oxygen if indicated? A. Oral glucose. B. Activated charcoal. C. Aspirin. D. Her prescribed nitroglycerin. Answer: C. Aspirin. This question tests your knowledge of medication administration for suspected acute coronary syndrome. The symptoms: sudden onset of severe, crushing chest pain, radiates to her left arm, nauseous, and short of breath are classic indicators of a heart attack, myocardial infarction. Aspirin is crucial because it helps prevent further blood clot formation in the coronary arteries, reducing damage to the heart muscle. While nitroglycerin can relieve chest pain, aspirin directly addresses the underlying clotting process. Always prioritize aspirin for suspected cardiac chest pain, as it can significantly improve patient outcomes by inhibiting platelet aggregation. Question 14. When lifting a patient, which of the following principles is most important to prevent injury to the EMT? A. Lift with your back, keeping your legs straight. B. Keep the weight as far from your body as possible. C. Use a power lift or power grip. D. Bend at the waist to pick up the patient. Answer: C. Use a power lift or power grip. This question focuses on fundamental principles of safe lifting and moving, crucial for EMT longevity and injury prevention. The most important principle is to use proper body mechanics, which includes using a power lift, lifting with your legs, keeping your back straight, and a power grip, palms up, thumbs wrapped around the handle. This technique minimizes strain on your back and maximizes the strength of your legs and core. Lifting with your back or bending at the waist significantly increases the risk of spinal injury. Always remember to lift with your legs, not your back, to protect yourself from injury. Question 15. What is the appropriate depth of chest compressions for an adult patient during CPR? A. Approximately 1 inch 2.5 centimeters. B. Approximately 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. At least 2.5 inches 6.4 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question tests your knowledge of high-quality CPR guidelines, a critical life-saving skill. Current resuscitation guidelines emphasize effective chest compressions as a cornerstone of CPR. Compressing the chest at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters ensures adequate blood flow to the brain and heart while minimizing the risk of injury. Too shallow compressions are ineffective, and excessively deep compressions can cause harm. For example, pushing the chest down adequately ensures blood circulates to vital organs. Always aim for consistent, deep, and rapid compressions with full chest recoil to maximize CPR effectiveness. Question 16. You are called to a motor vehicle crash. Upon arrival, you note a strong odor of gasoline and leaking fluids from the damaged vehicle. The patient is trapped inside. What is your immediate action? A. Attempt to extricate the patient immediately. B. Establish incident command and request hazmat. C. Apply a cervical collar and assess the patient. D. Don personal protective equipment and approach cautiously. Answer: B. Establish incident command and request hazmat. This question tests your understanding of scene safety and hazardous materials recognition. The keywords strong odor of gasoline and leaking fluids from the damaged vehicle immediately alert you to a potential hazardous materials, hazmat, situation. Your immediate priority is to ensure scene safety for yourself, your crew, and bystanders before patient care. This means establishing incident command, isolating the area, and requesting specialized resources like a hazmat team to make the scene safe. Never approach a hazardous scene until it has been deemed safe by qualified personnel. Question 17. You are assessing a 5-year-old male who fell from a tree. He is conscious and crying, but you observe an open fracture to his left tibia with moderate, steady dark red bleeding. What is your immediate priority for managing this injury? A. Splint the fracture. B. Apply direct pressure to the wound. C. Cover the wound with a sterile dressing. D. Assess for distal pulses. Answer: B. Apply direct pressure to the wound. This question assesses your understanding of immediate priorities in trauma, specifically bleeding control. The keywords open fracture, moderate, steady dark red bleeding indicate active hemorrhage. While all options are important for a fracture, active bleeding, even if moderate, can quickly become life-threatening, especially in a child. Direct pressure is the most effective initial method to control venous or capillary bleeding and is a critical first step before any other wound care or splinting. Remember, controlling severe bleeding always takes precedence over splinting an extremity fracture. Question 18. An EMT is required to report certain incidents to appropriate authorities. Which of the following is typically a mandated reportable event? A. A patient refusing transport against medical advice. B. A suspected case of child abuse or neglect. C. A minor injury to an elderly patient. D. A patient experiencing anxiety during transport. Answer: B. A suspected case of child abuse or neglect. This question addresses the legal and ethical responsibilities of EMTs regarding mandated reporting. Certain incidents, such as suspected child abuse, elder abuse, domestic violence, and sexual assault, are legally required to be reported to specific authorities, e.g., Child Protective Services, law enforcement, even if consent is not given. This protects vulnerable populations and ensures that appropriate investigations can occur. While other scenarios might warrant careful documentation, suspected abuse is a non-negotiable reporting requirement for healthcare providers. Always be aware of your local mandated reporting requirements and act on them promptly. Question 19. You are called to a nursing home for an 88-year-old male who is unresponsive. Nursing staff report he has an altered mental status and has not eaten much in the past 2 days. His blood glucose level, measured by your glucometer, is 45 milligrams per deciliter. What is the most appropriate immediate intervention, assuming local protocols allow? A. Administer oral glucose. B. Administer activated charcoal. C. Initiate an intravenous line for fluid administration. D. Place the patient in the recovery position. Answer: A. Administer oral glucose. This question assesses your ability to manage a diabetic emergency, specifically hypoglycemia. The keywords unresponsive, altered mental status, has not eaten much, and a blood glucose level of 45 milligrams per deciliter, which is significantly low, are all strong indicators of hypoglycemia. Oral glucose is the immediate and most effective treatment for a conscious patient with hypoglycemia who can safely swallow, as it rapidly raises blood sugar levels. For an unresponsive patient, or one who cannot protect their airway, oral glucose would be contraindicated, but the question implies consciousness sufficient to consider oral administration if the patient could protect their airway. If the patient is responsive enough to maintain their own airway and swallow, oral glucose is the best initial intervention. Remember to give sugar for low blood sugar, but only if the patient can protect their airway. Question 20. A 6-month-old infant is found unresponsive, apneic, and pulseless. There are no signs of trauma. After ensuring scene safety, what is your initial action? A. Administer 1 rescue breath. B. Begin chest compressions. C. Check for a carotid pulse. D. Deliver defibrillation. Answer: B. Begin chest compressions. This question focuses on the initial management of an unresponsive, apneic, and pulseless infant. Current guidelines for pediatric cardiac arrest emphasize immediate chest compressions. In infants and children, cardiac arrest is most often respiratory in origin, but starting compressions quickly is critical for perfusing vital organs while help is summoned or more definitive care arrives. Waiting to check a pulse or administer a breath delays crucial circulation. For an infant who is unresponsive, not breathing, and has no pulse, immediately initiate chest compressions. Question 21. A 45-year-old male presents with sudden onset of severe headache, slurred speech, and weakness on his right side. He has a history of high blood pressure. Your assessment findings are consistent with a stroke. What is the most critical information to obtain for the hospital regarding this patient? A. Last oral intake. B. Time of symptom onset. C. Patient's exact address. D. Family medical history. Answer: B. Time of symptom onset. This question emphasizes the critical importance of accurate timekeeping in stroke assessment and management. The symptoms, sudden onset of severe headache, slurred speech, and weakness on his right side, strongly suggest a stroke. The time of symptom onset is paramount because it dictates eligibility for time-sensitive treatments like thrombolytic therapy, clot-busting drugs, at the hospital. This information helps the receiving facility determine the best course of action and is often the single most important piece of data for acute stroke. Always pinpoint the exact time symptoms started, as time is brain when managing stroke patients. Question 22. Which of the following is a common sign or symptom of attention pneumothorax? A. Bradycardia, slow heart rate. B. Absent or diminished lung sounds on the affected side. C. Jugular vein distension, JVD, with normal blood pressure. D. Flail segment of the chest wall. Answer: B. Absent or diminished lung sounds on the affected side. This question tests your recognition of critical signs of a life-threatening chest injury, specifically attention pneumothorax. Attention pneumothorax occurs when air enters the pleural space but cannot escape, causing lung collapse and a mediastinal shift. A key clinical finding is absent or severely diminished lung sounds on the side of the injury because the lung is compressed and cannot adequately expand. While JVD can be present, it typically occurs with hypotension, and a flail segment is a separate injury. Always auscultate lung sounds bilaterally and quickly recognize their absence as a sign of significant intrathoracic pathology. Question 23. You are called to a 55-year-old male complaining of difficulty breathing. He states he has a history of COPD and uses home oxygen. His oxygen saturation is 88% on room air. He is alert and speaking in full sentences. What is the most appropriate initial oxygen delivery device for this patient? A. Non-rebreather mask at 10 to 15 lpm. B. Nasal cannula at 2 to 4 lpm. C. Bag valve mask ventilations. D. Simple face mask at 6 lpm. Answer: B. Nasal cannula at 2 to 4 lpm. This question assesses your understanding of oxygen administration for patients with chronic obstructive pulmonary disease, COPD. While 88% saturation is low, for a COPD patient who relies on hypoxic drive, their drive to breathe is stimulated by low oxygen levels. Administering high-flow oxygen can suppress their respiratory drive. The goal is to carefully titrate oxygen to improve saturation without causing hypoventilation. A nasal cannula at a low flow rate allows for precise control of oxygen delivery, slowly increasing saturation while monitoring their respiratory effort. Always be cautious with high-flow oxygen in COPD patients. Titrate to effect, usually aiming for an SpO2 of 88 to 92%. Question 24. You are on scene with a 3-year-old male who ingested an unknown quantity of household cleaner. He is conscious but crying and drooling excessively. His airway appears open, but you hear gurgling sounds. What is the most appropriate immediate action regarding his airway? A. Apply oxygen via nasal cannula. B. Perform a finger sweep to remove the substance. C. Suction the airway immediately. D. Place him in the recovery position. Answer: C. Suction the airway immediately. This question assesses your airway management skills in a pediatric patient with a potential aspiration risk. The keywords ingested an unknown quantity of household cleaner, drooling excessively, and gurgling sounds indicate a wet airway that needs immediate clearing. Gurgling sounds specifically suggest liquid in the airway, and suctioning is the most effective way to remove fluids and protect the airway from aspiration. A finger sweep is only for solid foreign bodies and is dangerous with caustic substances. Always suction a wet airway to prevent aspiration, especially with ingested toxins. Question 25. You are assessing an unresponsive patient who has pinpoint pupils. You find a prescription bottle for oxycodone nearby. What medication, if carried by your service, would be indicated? A. Aspirin. B. Activated charcoal. C. Naloxone. D. Oral glucose. Answer: C. Naloxone. This question tests your knowledge of managing opioid overdose. The keywords unresponsive, pinpoint pupils, and the presence of oxycodone, an opioid painkiller, are classic indicators of an opioid overdose. Naloxone is a specific opioid antagonist that rapidly reverses the effects of opioid medications by binding to opioid receptors, effectively restoring respiratory drive and consciousness. Administering naloxone is a life-saving intervention for suspected opioid overdoses, often leading to dramatic improvement in breathing and responsiveness. Always be prepared to administer naloxone to patients with signs of opioid overdose, as it can quickly reverse respiratory depression.